So I'm still kind of in shock about the whole thing, but over the weekend I had my very last, well, likely very last bedside nursing shift because I graduated from NP school and now I'm going to probably hopefully get a job in that. But that's crazy. So I've been reflecting a lot on what my favorite aspects of bedside nursing are and just getting super sentimental and emotional over things I'm really gonna miss about it. So I thought today's video I would just do 10 things I absolutely love about bedside nursing, and then we'll throw in 5 that are not my favorite because let's be honest, even though it's a super great job, there are definitely aspects of it that are like, and I want to be real with you guys and let you know that there are definitely great things about it, and then there's parts that you should probably know about, otherwise you'll be like me and when they happen you're like, oh my gosh. So we'll cover both of them. We'll do double the amount of positives than negatives because trying to keep things light and positive because I don't want to be a total downer, and there are definitely more good things than bad things about it. And isn't that like a rule? You're supposed to have, like, I guess it's the 80-20 rule, but we're gonna do the 1-2 rule. Sorry. And if you guys are new here, I'm Liz. I'm a pediatric nurse. I just graduated from FNP school, and that's what I talk about here. I make 2 to 3 videos a week on my journey, just kind of through nursing and getting an NP job and all of that good stuff. So if you're into that, make sure to subscribe below, and let's get looking at this list. Positive number 1 is you go to work and you make a difference. This, I feel like sometimes you forget going to work, but you're literally going to work, meeting people on some of the worst days, months, weeks, whatever, of their lives, and you have the opportunity to go in and make a positive difference in their lives, which is huge. I feel like not everybody's job can say that. You know what I mean? That at the end of the day, you can be like, yeah, I made somebody's life better. And that's an awesome feeling. Positive number 2 is your job is always changing and you will never be bored. You know how you hear about those mythical jobs where people are like, yeah, I just sit on Reddit all day. I'm so bored. I wish I had something to do. That won't be you, my friend. You will never be bored. But I never wanted a job that I was going to be sitting in a desk in a windowless room. You'll just be in like a windowless hospital. Just kidding. Most of them have windows. But you'll never be bored. There's always something to do. Even if your patients are fine, there's always somebody else that isn't fine and you can go help with them. So bonus point, you're always gonna get your steps in too, always. All right, let's talk about our first negative, and that would be nights, holidays, and weekends. When I was in nursing school, people threw that out. They were like, oh, you're gonna have to work nights, holidays, and weekends. And for whatever reason, my little nursing school self was like, oh, that's fine. And then you actually got into it and I was like, I'm working Christmas and I'm never home at night and I only have every other weekend off. And that like struck me like boom, and I don't know why, because people warned me about this. So just kind of, I've made videos about kind of talking about working on holidays. I'll link it up here and in the description below. It's doable, guys, and you get used to it. It just still makes me sad, I'll be honest. Sleeping at night, now I prefer night shift actually because the people are rocking and awesome. And I have another video on how to succeed being a night shift nurse if you want to watch that, and I'll put that down here too. But it's just different. It's an adjustment, and the every other weekend thing, you're gonna miss some stuff like birthday parties, get-togethers, you know, your friend's significant other, they're probably gonna have every weekend off, and so they're gonna be like sitting around the house, and then on Tuesday night, you're gonna be like, let's go hardcore, and they're like, yeah, I'm tired. So just something to kind of think about. Positive number 3, your learning opportunities are literally endless. Like, one, I mean, there are just so many different things you can do as a bedside nurse. There's so many different types of bedside nursing. If you get bored with one, go to another type in like a year or 2. You can just stack all this knowledge on top of each other. There's always procedures to watch. There's always something to look up when you encounter a patient comes in with a weird diagnosis and you've never heard of it. You can look it up and now you know. There's always procedures, things are always updating. One of my favorite things to do is in our cath lab on my floor, you can literally go in, and if you have a minute, they have up on the TVs, you can see the current OR case for open heart surgery. Like, how cool is that? And usually there's like other people will be back there and you can hear them talking about it because it's a teaching hospital, so they're talking out loud, and it's seriously just so cool. And there's just procedures that you can hop on all the time on your floor. So if you want to learn, you can learn, and I think that is so cool. Positive number 4 is you get to be there for a lot of the good news. You get to see your patients improving. You get to see medicine doing what medicine is supposed to do. You get to see your patients getting better. They come in real sick. You're along for the ride, seeing them get better and better and better until they finally go home. It's seriously so cool to like see it work. If you work in labor and delivery, you're there when babies are born. Like, how precious is that? One of my absolute favorite things that I will never ever forget. I worked on a pediatric cardiology floor, and before that adult GI and liver. and we did transplants on both of those floors. And being able to tell kids and their parents, you're getting a heart today, because they let the nurses do it a lot. You're getting a heart. And then we would go and we would watch the helicopter come in that was bringing their organ in. I can remember every single time I was able to do that. And that is just one of the glowing, like, I will always remember doing things like that. So there are so many positive things like that that will just stick with you forever. And on the flip side, that leads us to negative number 2, is it can be really freaking sad, like really sad. And I think everybody obviously knows this going into nursing. You know that everything isn't always going to end up well. And I think you just have to, everyone will find their own way to cope and deal with everything. But being a nurse has definitely made me a different person because of the really hard things that I've seen. It has changed my outlook on life. It's changed how I treat people. It's kind of, I mean, it's given me the benefit of, like, I go home and I, hug everybody I love a little harder. But it's changed me seeing some of those things. And like I said, everybody's gonna learn to kind of process it different. You need to find an outlet on how to process it. So if you're in nursing school, even just start thinking about that now. How are you going to process some of these emotions? I will, conversely, I'll never forget some of the really positive stuff. I will never forget some of those patients that had just all of a sudden took a terrible turn for the worst, and seeing the faces of loved ones as they lose their most precious people. That is also something that will be with you forever. So that's depressing and heavy, but that leads into my next point, which is our positive number 5, which is something that I truly did not anticipate becoming a positive in my life. So I have absolutely fallen in love with palliative, end of life. And this always sounds kind of weird. You like providing care for people as they're dying. But it's really one of the most intimate and special things we get to do as nurses is provide care for patients and their families as they're exiting this world, because you can make that experience as positive as possible. You can make them as comfortable as possible. You can provide the family with the level of education that they want. Do they want to know the signs and symptoms of the end is coming, or would they rather not? I feel like nurses, we have the unique opportunity of really meeting patients where they're at and trying to make that experience that they are having better, and nothing does that as well as palliative care. So that is something huge that's come out of that for me, is being able to provide comfort for those patients and their families in their last moments here on earth. And I've carried that over a lot into my practice as a family nurse practitioner. You see a lot of things that are going to end up being fatal for these patients, and the conversations are just not happening. And I've really been able to pull that into my practice and kind of start those conversations early. Hey, let's start making you comfortable now. You can start doing palliative care within, the years really of the end of their life. Because after all, you want to have a lot of life in your years, and dragging on your years just of your life just because isn't always worth it, in my opinion. That might be controversial. Negative number 3, and I'm really sorry if this offended any of you, and if you are this, I am so sorry, but management. Holy moly. I have had one really good manager. I will say she was great. Some of my other ones, I'm just they tend to be nitpicky about the weirdest stuff that you don't care about. And obviously they care about it, but they're looking at it from a more of a business mindset. They have lots of charts and analytics, and you care about it from a nursing, what I need to get done to make this patient better overall type of thing. So you don't really care as much about the whiteboard. You're more worried about your patient that is now white because they're bleeding out, but they're really worried about that whiteboard for some reason. Something about the whiteboard. Why are you so worried about the whiteboard, management? Tell me. So that's just one thing. I think there's just a little bit of a disconnect. I have literally had a manager yell at me before for running into a patient's room when their heart stopped beating because I didn't gown up and they had a cold. I was well, they're not breathing, so I'm not too worried about it at the moment. They're not going to get droplets on me, but just kind of an example. If you have a great manager, I want to hear about it. And if you are a manager, I'm real sorry. Ugh. That's why I work nights and weekends, guys, is I can't hang with that. Positive number 6. One of the best feelings is being able to advocate for your patient. So knowing enough to kind of recognize things that are going on and be able to stand up for someone to promote their health and then see it go well. And people are yeah, you caught that. Good job. You're fluff my feathers a little. That's the best feeling. It really is. It's cool to be able to feel competent and you're a superhero. It's pretty great. Positive number 7, 12-hour shifts. Working 3 days a week. You can't beat that, my friends. You cannot. They're really long days, and you do need a day or two to recover afterwards, but you still have 3-day weeks. You can stack those puppies and have vacations without actually using your PTO. Magical. It's wonderful. Going into clinical like 5 days a week, I was like, 9 to 5, Monday through Friday? What? 3 days a week. Perfect. Negative number 4, they can hold you hostage at your job, so you can get mandated. So that kind of piggybacks onto the benefit of 12-hour shifts. This is the downside to them. So you've been there for 12 and a half hours, and then your little charge nurse rolls around the hallway and she's like, ooh, we're short on the next shift. You have to stay. You're like, what? So they can legally, in most states, some states it's not like this. Let me know if you can't get mandated. And let me know in the comments if you're a nurse, how long you've been at work. I think there's like a law, like you can't be there 20 hours or something, but it's a really long time. The longest I've ever been at work, I think, was 16 and a half. Maybe 17, because like at the end of something catastrophic happened, and then I had to stay in chart, and I was like, oh, brain dead. Anyway, back on topic. They can literally hold you hostage, or you can lose your license for patient abandonment. So that's fun. Positive number 8. This is kind of a selfish one, but it is seriously empowering knowing you can save lives. Like, oh, I know how to handle that situation. You're bleeding out from that hole. I know how to fix that. Or your blood pressure is doing this real funky thing. Like, nah, not a problem. I got this. That's the best feeling. And don't worry, it's obviously not there right away because you're really not quite sure in the beginning, which is totally normal. New nurses, don't fret. But after a little while, you just kind of feel like, oh yeah, it's a good feeling. I save lives. Not a big deal. Negative number 5 is it's stressful. So I worked mostly on step-down units, intermediate care, and then general care. And you can have like 5 patients. And if 5 of your people are not doing well, it's real stressful. There is just a lot going on. In the ICUs, it's the same thing. You're watching people who are like, they're real sick. And then if you have 2, and they're both not doing well, it's like, ah! So you're just busy. There's not enough staff. Nurse-patient ratios are not always awesome. I was really fortunate. I worked at a hospital that your max was 5. I know some people go up 6, 7. If you work in long-term care, those people are miracle workers, and they have like half the world under their care. So if you ever see legislation out there about getting nurse-to-patient ratios smaller, go sign that and find all your friends and make them sign it, because it's not safe. Positive number 9 are the relationships you build with your patients and their families. So if you have people that are going to be there for a really long time, whether they're really sick and they need a long-term treatment, they have cancer and they're getting chemo for a long time, they're waiting for a heart, there are people that are going to be with you for a really long time, and you're going to get to know them. And I know they always say, like, you're supposed to put a wall up and not get, whatever. If they're there for a long time, you get attached. And the bond, like, it's just so cool to get to know people in that way, and they get to know you. And then when they come back to the unit, when they're all better, that's a super special moment. I work on a unit where a lot of babies are going to need multiple surgeries. So you literally get to watch them grow up. So you were there, you took care of them day 2, day 3 of life. And now they're this sassy little 4-year-old walking in the room, and the parents know you, and you know the kid, and you can be that old lady who's like, I remember when you were just a wee little baby. And they're like, eh. It's really fun. And positive number 10, I've talked about this in other videos, but I love like the patient teaching aspect of everything. So just getting to teach parents how to take care of their child and helping them feel empowered and know like what is going on inside their child, how their child might show signs and symptoms of that, and how to properly care for their kid is awesome. Same thing with adults. How do you take care of yourself? What is going on in here so that they understand, like, this is your disease process, what's on in here. So this is why we're making you do these other things, and seeing it click, and then they do it. And it's just great. Making other people feel empowered and in charge of their own healthcare it just makes me happy. All right, guys, so those are my 10 things I absolutely love and 5 things I'm about bedside nursing. I hope you guys are just as in love with aspects of your job as I was with mine. And if you're still in the process of becoming a nurse, I hope this gives you an idea of what nursing is kind of going to look like, and things to look forward to, and just things to like mentally prepare for. Sorry if the sad ones were too sad. It is absolutely a challenging journey in the beginning when you're first becoming a nurse, but it is oh so worth it, and I am really going to miss it a lot. Thanks for hanging out and watching this video with me today, guys. Again, if you are new, make sure to subscribe down below and hit the little bell if you want to see more videos like this. And follow me over on Instagram, where I post updates all throughout the week and little medical fun facts. facts. And we always have a question of the day. So the question of the day today is, what are 2 of your favorite things about your job, whatever your job is? And you can put 1 negative in there too. But 2 favorites, maybe 1 negative about the job you have now, and let me know what it is down in the comments below. I'm super excited to see what you guys love and not so love about your jobs. All right, guys, have a great week. I will see you later. Bye.